So today I'm going to show you how to reconstitute your peptides from a trusted vendor. So first I'm going to show you my little box of tricks. I got bacteriostatic water. Okay, you need to make a solution. I got my peptide of choice, which is going to be MOTC. And then we got a alcohol swab, which I don't actually have a real alcohol swab. This will be for demonstration. And then a brand new insulin syringe, 31 gauge. Okay, so first you'll be opening this up. Bam, just like that. Okay, once you have this, open this. Be very careful. Open this. Okay, next, pull this to get some air into the syringe. Now take this and put it into your bacteriostatic water. Bacteriostatic water means there's no bacteria, it's sterile. Okay, take this and you put it directly into the center and use your alcohol swab to clean the top. Directly into the center. Push the air in. Because this is a vacuum, right, there's no air able to leave this, so then you got to change the fluid volume. Flip it upside down and pull the water out. Get it to about 100 units or 1 ml. Okay, once it's at 100 units, right there, perfectly on the dot, pull it out. Okay, this seals itself. Okay, you're done with the water. Take your peptide, got MOTC, pop the cap off. Okay, now you have the rubber exposed. Do not touch it with your skin. It's always best to take an alcohol swab and swab it off. Okay, now you take your water, your 1 ml, and you inject it into the center of your peptide. Just like so. Okay, as you can see, it's already pulling it because it's like a vacuum. There's no air inside there and it can't escape. So it's gonna pull things in or it's gonna push it out depending on how much pressure is in there. Okay, next I like to pull this out and inject more air back into it so that I don't have to fight it. Okay, see that? Just pulling the air right in. Okay, now it will allow me to take some out. So first, shake it, make sure everything is dissolved. Okay, looks pretty good to me. See, no solutes. Okay, the MOTC dosage is about 5 units, so that's very, very small. So here to there. Okay. Right about there. Hold it tight and pull. Okay. So now I take my MOTC, put it back. Take my alcohol swab. Swab the area. Okay. Make sure you're checking for air bubbles. There should be no bubbles in here, none. That's why doctors do this, because it gets them to the top. And then they push a little bit out just to make sure there's no bubbles. Okay. This goes right into the center of your arm. Very, very easy. Okay. Make sure that the muscle is very relaxed and loose because it will hurt much less. This also really doesn't hurt if you do it right. Try to keep it nice and relaxed. Boom. Okay, see it's in there. Push it in. Done. Pull it out nice and slow. Okay, I bled a pinch, not a problem. Take this, always put the lid back on. And now it is always good practice to throw these out when you're done. However, I do not, because it's expensive to keep doing that and it's my blood and I'm making sure that my procedures are sterile. Do not share needles, obviously, but you can get away with using your own needle a couple times. It does get dull over time, so you know, you don't have to keep using your needle. I would actually suggest you use a new one every time, but it can get costly, so in a pinch you could. So there you go. Massage the area. You're supposed to wipe it with your alcohol swab. Okay, and that's it.